Good afternoon and welcome to you all, ladies and gentlemen, who have joined us via various social media channels, Facebook, YouTube, Twitter, and the Dr. Fundi website. My name is Dr. Fundi Lenyati. Today, we are going to have a short 30-minute conversation with a special guest, Dr. Jonathan Bloomberg. He will be representing the South African Solidarity Fund, which is only 2 months old. This is an independent fund that was set up on the 23rd of March with a special purpose to help South Africa to respond to the COVID-19 crisis in South Africa. Let me welcome Dr. Bloomberg.
How are you? Nice to be with you. Thank you for the invitation.
All right, welcome to our channel, Dr. Bloomberg. I was just introducing you to say today you are wearing a hat where you are going to represent the South African Solidarity Fund. Other people will know you as somebody who is the CEO of Vitality at Discovery. But today you are here to help us to understand a little bit more about the South African Solidarity Fund and specifically the initiatives within the area of health. So maybe to kickstart our discussion today, how would you describe your responsibility within the fund in the area of health?
So again, good afternoon and thanks for having me again. I'm very pleased to be here with you. So the Solidarity Fund, as you'll know, Fundile, is focusing on 3 broad responses to the COVID-19 pandemic in South Africa. The one is the health response. A second is a humanitarian response, so provision of food and other social support. And the third leg, if you like, is communication, solidarity communication in relation to, assisting people to understand the need for social distancing, compliance with that, and other aspects of coping with the pandemic. So the major stream thus far is the health response, and that is my role. My title is the health lead. So my role is to work with colleagues in the fund to identify the key priorities within the health environment which the fund should support, to work with people who are submitting proposals for funding, marshal those proposals through the process, and then try to make decisions and allocate the money. So that's what I've been working on since we started for the last couple of months.
Yes. So now if we then look at, so you are obviously dealing with the health response, but you are dealing with that within the context of the broader, mandate of the fund. Exactly. And I understand the fund is hoping to raise something like 4 billion, and about 2.55 has been raised to date. Now, the health response, just broadly, when we're talking about that, what are we talking about?
Yeah, thanks. That's a very important question. So firstly, it's not really one thing. It's quite moving depending on where we are in the pandemic. So if we go back to 8-9 weeks ago at the beginning, in early March, the overwhelming urgent need at that time, as you will know, was PPE, because there was a very significant shortage in the country, and it was clear that the procurement mechanisms in the provinces were going to take a little time to start bringing in necessary stock. So the very first thing we did, working directly with the Department of Health, the National Department of Health, was make provision, of significant amounts of money, over 800 million rand, for the procurement of urgently needed PPE equipment,
Yes.
We work closely with Business for South Africa. You'll be aware of that. That's the business response, which did set up a procurement mechanism.
Yes.
And over that time, the B4SA procurement mechanism has taken this funding from the Solidarity Fund and has purchased, close to that 800 million rands worth of PPE.
Yes.
A lot of that is already in the country. A significant amount has been distributed to the provinces already. Some of it is waiting to be distributed, and some of it is still arriving. But that was phase one, Fundile, which was PPE. Following quickly on the heels of PPE, the next immediate priority became testing.
Yes.
And you and your audience will all know, even in the media today, there's still a lot of focus on backlogs in testing and so on. And so we have moved quite quickly on that front. The first thing we did was make a large grant, 250 million rand, to the National Health Laboratory Service to support the NHLS in purchasing the test kits. We've also then supported some other proposals. A second one is a very exciting proposal to bring on board a number of the academic laboratories. They sit in the universities. And as you would imagine, they're normally there to do research, but they all have the capability of doing COVID-19 testing.
Yes.
So we've supported a proposal from the South African Medical Research Council and the NHLS to bring on a large number of academic labs who can take any overflow testing from the NHLS, and that's already happening in the Western Cape as we speak, where, as you know, the backlog is significant.
Yes.
We've also funded an exciting proposal alongside, a private pharmacy group, Dischem, who are rolling out a large number of walk-in testing centers where people in underserved areas who would struggle to find a public clinic, or they'd have to get a taxi or walk, they can go to the parking lot of a shopping mall and have a free test. And the Solidarity Fund is funding the cost of that. So we've done a lot on testing.
Yes.
A third area, Fundile, has been ventilators. So you will be aware, as the numbers of cases are building up, there's great concern that what the model shows, we will reach a point over the next 1 to 2 months where there's a surge in very sick patients in hospital. They will need, breathing assistance. And so we were very excited to support a project led by the Department of Trade, Industry and Competition, alongside the South African Radiological and Astronomical Laboratory, to develop a local ventilator manufacturing capability. So the Solidarity Fund funded the prototypes for these local ventilators. And we understand the plan now is to manufacture as many as 50,000 of these ventilators locally over the next few months. And so that's been a very important response as well.
Yes.
And that brings us up to literally where we are today. And one of the next things we will be looking at is the question of supporting some of the public hospitals to upgrade their intensive care capability with equipment and beds, because it does seem like there's going to be need for more ICU beds and equipment than is currently available.
Yes.
But, in a nutshell, that describes what we've been doing in the health response.
Yes.
There's obviously more demand than we've got funding. So we're also out there still trying to raise more money. So that's also very important.
Yes. Now, obviously, the Solidarity Fund is an independent fund. It works closely with government. It works closely with business, but it is an independent fund. Now, in terms of the priorities that you guys have already responded to, is there a very close working relationship with government in terms of what needs to be done? And once you've sourced those things that you've sourced from various places, let's send so many to Western Cape, let's send so many to Eastern Cape and stuff like that?
Yes, the short answer is yes. There's been, from the beginning, an excellent working relationship. Some of the proposals, Fundile, actually, they come from the National Department of Health or one or more provinces. And then we obviously work very closely with them. But I can tell you that even when the proposals come from other stakeholders, our first port of call is to get together with the senior officials in the Department of Health, or the NHLS, the laboratory service, to say, does this proposal fit with your plans and your priorities?
Yes.
And unless it does, then the fund would not fund it because it's too easy to distract everybody. And, everyone's got a good idea and people are putting enormous energy and good faith, but we must be very selective and choose those high impact projects that are fully aligned with the Department of Health and the provinces. So it's been an excellent relationship, and we think it will continue that way.
Yes. Now, with the phase one that you talked about, where you guys were focusing on sourcing PPEs, I understand that the rest of the world has also been scrambling to get the same stuff that you were looking to procure for South Africa. How easy or how difficult has it been to actually get those, and also the issues of fluctuation of currency and all of that, demand and supply issues?
Yeah, it's a great question. And I think it's been very difficult. As you say, the entire world's been buying. And until this crisis, a huge amount of the world's manufacturing of most PPE was located in China. Not only was it located in China, but a lot of it was in the Hubei province, which was quite badly affected at the beginning of the pandemic, as you know. So you had the whole world scrambling, and the net result of that was, firstly, it was very difficult to get large volumes, and the prices were very, very different, 5 or 10 or 15 times higher than a few weeks before the crisis. So, one tricky thing has always been, are we getting the right quantity, the right quality, and the right price?
Yes.
And we had to often move very quickly, because if you don't make the decision, some other country is going to buy them from under your nose.
Yeah.
I'm pleased to tell you that the conditions are a little bit easier now. So over the same period, there's a lot more manufacturing has been ramped up. The most exciting thing for us, again, with really good support from Business South Africa and from the DTIC, is we are seeing very exciting green shoots of local manufacturing of PPE. Yes. We've already seen some of our funding being used to procure from local manufacturers. And my hope is that one of the legacies of this awful period, one of the good legacies, will be a sustainable local industry that can create jobs and manufacture equipment like PPE for our healthcare system. That'll be a wonderful thing, rather than exporting our rands to import from China or other countries. So it was very difficult. It's got a bit easier, and our focus now is buy local wherever we can.
And the logistics of bringing this stuff here, in the context of airlines, having stopped and all of that, was there any challenge that you guys were experiencing broadly around, bringing the stuff to South Africa?
Yeah, huge challenges. And actually, we're still experiencing some of them. The main challenge was that air freight costs, again, went up multiples of what they were before, really multiples, which is very problematic. And so bringing in, you find that for every consignment of stock you bring in, a very significant proportion of the cost is the air freight. Whereas if you look at the equivalent cost of shipping, it's a fraction, but because a lot was urgent, we had no choice. So cost of air freight was a big thing. And then there were difficulties in getting stuff here. I must say that, Imperial, who have been the procurement partner for BSA, were very good at chartering flights. So there were a number of flights were chartered at quite competitive prices, and those were able to fly in from China to Johannesburg to bring the stock. Again, that's getting a little easier now. Some of the big commercial airlines are flying more cargo planes. You know, there were also problems at customs on both sides, clearing the goods on that side and clearing them this side. But all of that is working a little better now.
Yes. Oh, so with a partner like Imperial, that has at least, helped you guys to get the stuff to where it needs to get.
Yeah, correct.
Yeah. Oh, all right. Now, on the area of testing, you've mentioned how you have capacitated NHLS, and also you're working with DISCAM in terms of those parking lot laboratories. Now, we also hear that there's been a shortage of reagents that are used as part of these tests by the labs. I don't know, I think Germany is one of the big suppliers, but I'm not sure other countries. What experience do you guys have around that? Have you experienced challenges in getting those reagents?
I mean, we have not been trying to procure them ourselves.
Okay.
But I know from our conversations, both with the NHLS and the private laboratories, that it's a huge problem. There's a relatively small number of manufacturers, Fundile, of these reagent kits. I think for your audience, you can think about these tests a bit like your printer at home. You get a machine like your printer, and then you have to buy the cartridges to do the tests, right? So these labs, they've got machines. And if you've got a machine from a company like Abbott in the US or Roche in Switzerland, you need the cartridges from that company to run that machine.
Yeah.
Sometimes you get generic cartridges, but mostly they're quite specific to their machine. And again, the whole world has been competing for those kits. That is still going on today. Unfortunately, we've heard information that certain governments have, prevented the manufacturers in their countries from exporting kits. Yep. They've said, you work in our country, you've got to sell every kit you make to our government. Yep. You can't export. And that's made it very difficult for countries who don't have local manufacturing of these kits. And as you said, it's a small number. The manufacturers are located in the US, some in Europe, and some in China. And so our labs have been buying from all three regions. But I think even up to today, I can confirm that there's a tremendous shortage of those kits. The Minister of Health made the same point in the last 2 days in the media and in Parliament, and he is correct. That is one of the major reasons, for the slowdown.
Yeah. Right. Now, you mentioned the issue of the backlogs, which was also something that was quite in the news yesterday. The Premier of Western Cape, the Minister of National Health, they all talked about this backlog issue. In your engagements with government, is there any move towards procuring rapid test kits, or maybe they have not yet reached a level of accuracy such that we still have to go through the pathology labs?
Yeah, so there's, Fundile, there are two, when you look at it from a clinical point of view, there are two issues with the rapid tests. The first is that they are not useful at all for diagnosing if you've got COVID now. Okay. Yes. They use antibodies, and as you know well, your body only produces antibodies at the earliest 4 days after the infection, but actually it can often take 7 to 14 days for a full response.
Yes.
So those antibody kits are they can be negative, but you can have the infection.
Yes.
And so that's very dangerous if they start being used to diagnose infection.
To diagnose. Yes.
They can be used at the right point in an epidemic. Firstly, if the government wants to understand at a population level what proportion of the population has been infected.
Yeah.
And I think they can be used if with the right policy, almost to be able to say to you as an individual, you were infected, you are now, you're at much lower risk of reinfection. Although we also know from the research that the fact that you had it 2 months ago doesn't give you absolute protection against a new infection.
Yes.
So far, the authorities here, the NICD and the department, have been very clear that they do not want antibody testing yet. And what's happening as we speak is that the SA Health Products Regulatory Authority, SAHPRA, and the NICD are testing these kits. And unfortunately, and this is a very important piece of information, many of them are very, very inaccurate. And so we need to wait for SAHPRA and the NICD to certify a small number that are truly accurate enough to be certified for use. So at this point, it's only the genetic testing in the labs, not the rapid testing.
Lovely, lovely. So as we go towards wrapping up our discussion, if you now reflect over the past 2 months and all that you have done, what would you say are the things that kept you awake at night? And what would be those things that you would say, you know what, all my sacrifices have been worth, because now there is something I can point at, that even when the mandate of this fund comes to an end, this will be the legacy of this Solidarity Fund.
Yeah, I think it's a good question to end on. Let me start with your second part of your question. I do believe that as tragic as this pandemic is in our country, and it is a terrible tragedy, both the economic hardship that millions of people are going through and the disease and loss of life. I do think there will be some lasting legacies here. And one of them is how the business and civil society, both at an organization level and individuals, stood up and volunteered and created incredible institutions to respond, and how those institutions have partnered with government. So that's a real positive legacy that I sincerely hope we can build on. And if that's one of the legacies, then I think we could all feel quite proud. I do think that some of the work that's being done all over the place is making an impact. There is PPE in the country, not enough, not in all the places where it needs to be, but I'm very sure that absent all the work of the fund and BSA and many other parties, there'd be even less now. We've got backlogs in testing, but they would be worse, et cetera, et cetera. So I think that, sadly, what keeps me up awake at night is that no matter how good our efforts are, our country is going through and is going to go through a very hard time, because even the richest countries in the world have not avoided a tragically difficult time, both from a health point of view and an economic point of view. So that's what keeps me awake at night, which is there are some things that happen to us as a species and a planet that despite our best efforts, we can't control properly.
Yes.
And that's very painful for us to admit as human beings. The other thing I think that keeps me awake at night is I really do worry when I see so many people kind of ignoring the pleas of our leaders to adhere to social distancing and to keep themselves and their families safe. I don't know why that is. I know some of it is that people live in conditions that make social distancing very difficult to comply with. But some of it seems to me that people just think it won't happen to them.
Yes.
You know, and that's very, I think, very sad. And we've all got a responsibility to talk to everybody in our circles, especially the leaders in our country, and to persuade people that the best thing we can all do is you know, hand washing, social distancing, wear a mask. You know, that's the best way we can avoid the harshest impact.
Yes. All right. Just one last one. I know I had said that was the last question, but if you now look at, you know, whatever amount that the Solidarity Fund has managed to get from donors, what percentage would you say is dedicated to the health response? You mentioned that there's basically three broad areas: the campaign, the humanitarian efforts, and then there's also the health response.
That's right. Will be applied.
I'm losing you there a little bit, Doc.
A minimum of 7.
You're breaking up a little bit there, Doc.
Oh, sorry. Let me repeat that again.
Yes.
The current view in the fund is a minimum of 75% of the funding available will be devoted to the health response. That may change, but that's the current position.
Yes. So basically, 3/4 of whatever that is collected is actually going to the health response. Was that is focusing on the health challenge? Was this is a health challenge with social and economic issues, but it's primarily focusing on the health challenge. Dr. Bloomberg, I need to thank you for your time. I know you are a very busy man, and we thank you for gracing our channel. May you continue doing all the good work. We continuing to watch from far, and we are very proud of what you guys are doing there. Thank you very much.
Appreciate it very much. Thanks. Bye-bye.
Thank you, Doc. Bye.
Bye-bye.
Bye. Thank you to all of you, our viewers. That was an interview with Dr. Jonathan Bloomberg, who is the health lead within the South African Solidarity Fund. He was really able to give us a picture of the kind of things that they are doing as the Solidarity Fund, specifically under the health response, which we have now been told that at least 3/4 of whatever rand that is raised by the fund actually goes to the health response. So I want to thank you for joining us this afternoon, and I want to wish you a safe and happy weekend. And I hope that when we get to level 3 next week on the 1st, people will still continue to observe, social distancing and do everything in their power to make sure that they don't get to be a statistic of COVID-19. With those few words, I want to thank you and goodbye to all of you.